बेंगलुरु के HBS हॉस्पिटल में काहो के तहत रीजनल डायग्नोस्टिक कॉन्क्लेव 8 जून 2024 को हुआ। एक रोजा कॉन्क्लेव डॉक्टर मोहम्मद ताहा मतीन, डॉक्टर आर रवि कुमार, डॉक्टर अपर्णा जयराम, डॉक्टर जुबैर हसन, डॉक्टर मिसबा शाहिद और दीगर एक्सपर्ट्स ने की शिरकत। इस कॉन्क्लेव का टॉपिक था गुड लैबोरेटरी प्रैक्टिस। डॉक्टर ताहा मतीन ने HBS हॉस्पिटल की सर्विसेज पर रोशनी डालते हुए कहा कि हर माह 4000 डायलिसिस HBS हॉस्पिटल में हो रहे हैं। इनमें 3000 डायलिसिस फ्री किए जा रहे हैं। डॉक्टर ताहा मतीन ने कहा कि इस तरह की खिदमत, इस तरह की सेवा दीगर हॉस्पिटलों सरकारी सतह पर क्यों नहीं हो रही है। डॉक्टर ताहा मतीन ने इस इशू पर भी अपनी बात रखी कि हेल्थ केयर सेक्टर में स्टैंडर्ड डॉक्टर्स, नर्सेस और टेक्नीशियंस की कमी का सामना है। इस मौके पर डॉक्टर अपर्णा जयराम, डॉक्टर रवि कुमार और डॉक्टर जुबैर हसन ने इस कॉन्क्लेव के सिलसिले में अपनी राय पेश की। जनूबी हिंद न्यूज रिपोर्ट।
As much as Dr. Aparna mentioned how crazy KAHO is, the consortium of accredited healthcare organizations, HBS is as much or even worse in its craziness. I believe that all doctors should be crazy. Doing good in this world is a lot of craziness. Thinking of the whole nation in labs and quality and improve it for the nation and for the people is a kind of craziness. I mean, she should be looking at how to make from 38 to 58 labs, or maybe 76. Why waste time here? That's craziness. We know what Dr. Ravi Kumar is. Why should he come here and do this? That's craziness. HBS Hospital also is one such crazy place where the land is being given by somebody, the building is being given by somebody, and you don't find the names of those people who gave that. Every single equipment that is there. We have a really good, well-equipped operation theatre and an ICU. It's very, very expensive. And we do about 4,000 dialysis here per month. More than 3,000 of which are completely free to the patient. No Bowring Hospital, no Victoria Hospital, no institute is able to do this on the government sector, and we should ask why. And why is such a small organization doing crazy things like this? Let Mr. Siddaramaiah do it, let Mr. Narendra Modi do it, let somebody else do it, let Nimhans do it. Why should we do it? I mean, that question bothers us. And therefore, it's my pleasure today to welcome all of you. And hi, Abhishek. And welcome all of you to this wonderful event where we are trying to bring awareness and to talk about practical proposals of how lab practices can be standardized. One of the biggest problems of healthcare in this country, among many, is the fact that we don't have standardized doctors. You get doctors, but you don't know what the guy knows and what the guy doesn't know. You get nurses, you don't know what. Sir, recently I had to give IV iron to a patient with like 6 gram hemoglobin. And I showed her a vial of 500 milligrams of NC-carb, of iron sulfate something. Each ml containing 100 grams. I made her read that 1 ml contains 100 grams. How much do 5 ml contain? Gottilla, sir. Nurse, about to give an IV injection. I have to pray, God. Here model. Doctors, nurses, lab technicians, laboratories, medicines. Nothing is standardized. You go to a hospital, you don't know whether the guy knows how to read an ECG or not. An ECG was done, stark ST elevations, acute MI, and the guy says, Nimge salpa gas ide, Pantodac kottu. And the guy died in the next 10 minutes right in front. And you saw an ECG. Whoa, what did the guy do? What are you going to do? Gentlemen, modern healthcare is based on a certain understanding of health and disease. And that certain understanding of health and disease that's been developed over the last 300 years includes an understanding that health is about chemicals, health is about organisms. And therefore, a large movement, Louis Pasteur, Robert Koch, and so many others, led a movement to understand. I mean, you should know what Koch's postulates are.
So, we are from KAHO. Dr. Ravi Kumar sir, very senior, reputed, microbiologist, ex-NIMHANS. He is our vice chair. I have Dr. Zubair, our young blood. He is the one who has conceptualized the whole program here. And I am Dr. Aparna Jairam. I am the chairman. KAHO is committed for patient safety and safe healthcare. Very, very important, because you can have technologies, you can have institutions, but people are the differentiators. So even if you have a whole lot of money, you can get the best car, but you need a good driver. So we are the people who are enabling the driver, the people. We hold their hand to get quality systems in place, so that ultimately patient is our goal. We want our patient to get the right treatment at the right time with the good results. So that's what KAHO is committed to.
Is it recognized by government of Karnataka or what?
So KAHO, a very good question. KAHO is not a profit-making association. It's a non-profit association. We are collaborating with Government of India. We are working with QCI, that's a Quality Council of India, recognized by Government of India. KAHO as a body is holding hands of NABL, NABH, who are the accrediting bodies for hospitals and labs.
Thank you.
Thank you.
So, what is your message about today's seminar? Good laboratory practices.
Today's seminar is a very important seminar, especially for doctors, nursing officers, and technologists. You know, good laboratory practice is the very important thing. To say that what you feed, you will get that result. That means what you are going to eat, you know, the outcome is that one. Like that, what you are going to do the test in the laboratory and other things, your results are good and you can take care of the patients very well. And KAHO is the one which gives a platform for all students, all technologists, all doctors, health professionals and other things. You can see a lot of programs are happening, you know, online, on-site, and then, you know, some CMEs and other things. And now onwards, we are also planning to conduct various parts in Karnataka and also all over the country. The programs has to be taken up. And then there are some accreditation programs are there. Other country people like Bangladesh and other people also are asking us to give certain things, you know, regarding good laboratory practice and then quality control and then accreditation process and other things. So I am very happy as a vice president in KAHO. We are doing good work for the patient safety finally.
So HBS Hospital has joined hand with KAHO. What do you say?
Yeah, it's a very good initiative which was done by KAHO, I would say, to have chosen HBS Hospital and vice versa. HBS Hospital also to have taken the initiative to take up this topic, because the way I see is that HBS Hospital has done a lot of good work and is now enable entry level accredited. So it is the right step to have partnered with KAHO, because KAHO does a lot of hand holding with a lot of hospitals all across the country. So it can be a mutually beneficial relationship for both the entities. The KAHO has so much of material, so much of resources to offer that not only HBS, every other hospital in the same bracket could benefit from the partnership with KAHO. It's a strategic partnership and which will help mutually both the entities.
How these efforts help to the common public, common man?
It's a very good question, because KAHO is patient centric. It's all focused on patient safety. So the more and more we go for accreditation, the more and more we go for these kind of conferences, we are only keeping the patient in mind. We are not keeping the accreditation or the certificate in mind. The patient is at the center of all these efforts. So it's patient centric, and if patient safety improves, you and I are also patients, right? We cannot say I'm just a doctor. When we go next time to a hospital, we'll be a little more assured seeing the symbol that yes, I'll be taken care of in a better way.
So in short, same treatment, same protocol. If you go to Zubair's hospital, you go to Ravi Kumar sir's or my hospital, the idea is similarity in the healthcare across, and that is only possible not by machines. Yes, machines is important, but by training of people. And I think that's how all the hospitals should come ahead. In fact, HBS had set us an example that how a institute, let it be small or big, if it comes, then KAHO is there. We have our champions across who will hold the hand and have we open this invitation to all the setups. Please come and approach us, and we will do this. You can see how many people are getting benefited. Thank you. Namaste.
That any good work will be magnified. So when Dr. Zubair proposed this initiative, we were like, why not? Let's do it. So thankful that we are all here today. So I'm just going to give a very brief introduction to both wonderful initiatives that are going on under Shama Charitable Trust, who's under the leadership and guidance of Dr. Taha Mateen, and who will be coming and speaking to all of us. So the two institutes that we run is one, HBS Hospital. It's a low-cost hospital that was started in 2012, and with a purpose and vision to serve those who cannot afford healthcare. And we all know that today healthcare is a very complex and challenged domain, both in terms of affordability and even accessibility, right? So the entire purpose was to set up an institute that is able to provide without compromising on quality and to be able to serve the needs. So we are a 100-bedded super specialty NABH accredited hospital with core focus on departments like OB-GYN, ENT, ortho, general surgery. We also have one of the largest dialysis center, 42-bedded, which serves around more than 300 patients who come for dialysis every week. And one of the most humbling aspects of the dialysis department is that 90%, more than 90% of our patients come from extremely poor backgrounds. And most of you who know what CKD is, it completely changes the life of a person, right? One of the first things that happens is you're not able to function more in terms of livelihood. So for them, poverty is a double-edged sword. They're anyways undergoing poverty, and then they are stuck with this condition. So at the center, we not only offer extremely subsidized to free dialysis, but we also take care of their food, monthly ration, transportation, scholarship for their children. So as much as possible, we try and help them to make their lives dignified, and that is what we believe in for every patient who steps into this hospital. Right? And of course, we have this is not possible without more than 200 staff that we have: doctors, nurses, paramedics, our administrative, our managers, who relentlessly work day and night to make this happen. The other institute is the Paramedical Institute, which was started in 2016-17. I am supposed to tell.
Phases. Our supply chain is different from the supply chain of the industries. Why? We all know. We will again see how it is different. Close to each other, the wrong picture, and material safety data sheet should be present and kept.